My name is Robert Bache, Medicare Bob. I own Senior Healthcare Direct, and we help people understand Medicare. In this video, in a Wellness Wednesday video, I'm going to discuss a very important topic, which is dementia and Alzheimer's disease. Right now, it is estimated that over 47 million people worldwide have dementia, and by 2030, that's going to be over 75 million. However, early detection of dementia can greatly improve the person's life and try to keep them a high quality of life longer. And Medicare does have preventative health care included in all of your Medicare benefits that cover a lot of the tests and doctor visits that can help you with early detection of Alzheimer's and dementia. Now, early detection is key. So in this video, I'm going to go over some early detection symptoms that if you or a loved one catch, you need to go see your doctor immediately to try to help you and start treatment as soon as possible. The first symptom is memory loss. Memory loss that disrupts daily life. One of the most common signs of Alzheimer's is memory loss, especially forgetting recently learned information. Others include forgetting important dates or events, asking for the same information over and over, increasingly needing to rely on memory aids, or a family member for things they used to be able to handle on their own. Another early sign is challenges in planning or solving problems. Some people may experience changes in their ability to develop and follow a plan or work with numbers. They may have trouble following a familiar recipe or keeping track of monthly bills. They may have difficulty concentrating and take much longer to do things than they did before. Another symptom is difficulty completing familiar tasks at home, at work, or at leisure. People with Alzheimer's often find it hard to complete daily tasks. Sometimes people may have trouble driving to a familiar location, managing a budget at work, or remembering the rules of a favorite game. Another sign is confusion with time or place. People with Alzheimer's can lose track of dates, seasons, the passage of time. They may have trouble understanding something if it is not happening immediately. Sometimes they may forget where they are or how they got there. Another sign is trouble understanding visual images and spatial relationships. For some people, having vision problems is a sign of Alzheimer's. They may have difficulty reading, judging distance, and determining color or contrast, which may cause problems with driving. Another symptom is new problem with words, speaking, or writing. People with Alzheimer's may have trouble following or joining a conversation. They may stop in the middle of a conversation and have no idea how to continue, or they may repeat themselves. They may struggle with vocabulary, have problems finding the right word, or call things by the wrong name. For example, calling a watch a hand clock. Another early sign of Alzheimer's and dementia is misplacing things and then having difficulty retracing their steps to try to find those things. A person with Alzheimer's disease may put things in unusual places. They may lose things and be unable to go back over their steps to find them again. Sometimes they may accuse others of stealing. This may occur more frequently over time. Another symptom is decreased or poor judgment. People with Alzheimer's may experience changes in judgment or decision making. For example, they may use poor judgment when dealing with money, giving large amounts to people. They may pay less attention to grooming or keeping themselves clean. Another early detection sign of Alzheimer's and dementia is they may withdraw themselves from work or social activities. A person with Alzheimer's may start to remove themselves from hobbies, social activities, work projects, or sports. They may have trouble keeping up with a favorite sports team or remembering how to complete a favorite hobby. They may also avoid being social because of the changes they have experienced. The last warning sign of dementia I'm going to go over is changes in mood. Changes in mood and personality. The mood and personalities of people with Alzheimer's can change. They can become confused, suspicious, depressed, fearful, or anxious. They may be easily upset at home, at work, with friends, or in places where they are out of their comfort zone. Dementia and Alzheimer's runs in my family, so it's something very personal to me, and I've lived through it with my loved ones. And I encourage that if you are a senior on Medicare and any of these early detections, early signs may apply to you, Medicare will cover preventative health care services for you so that you can have a better life as you move forward. Because early detection is key, early treatment. There's no cure per se for Alzheimer's dementia, but there are exercises that you can do that will help you have a higher quality of life longer. Alzheimer's dementia is a real issue in our society now, especially with baby boomers as they get older. As I mentioned, we're looking at going from around 40 million people now to by 2030 being over 75 million people with this disease. So it's imperative that you ask your doctor, how can I prevent myself, or how can I have a higher quality of life if you start seeing these early detection signs. If you're watching this video and you have friends or loved ones that you want, that you think some of these signs may apply to, I really encourage you to try to encourage them to go to their doctor. Cost should not be a reason not to go get help. With Medicare, it does cover preventative services, so there should not be a cost to schedule an annual visit for this. And please, see your doctor, bring this up to them and ask them how they can help you. And you have Medicare, you have coverage, so use it and go get help that you need so you can have a higher quality of life longer.